Well, new concerns now over the future of America's health care after some of the country's top medical experts yesterday warned the U.S. Senate about the growing doctor shortage in America. Here's just some of what they had to say.
As we've heard today, that nearly $10 billion is spent by the federal government to support these hospitals, but currently we have no planning in place to actually meet the needs of our population in the United States with regard to a physician workforce.
It is estimated that as many as 30 million Americans will gain coverage through Medicaid and or the health insurance exchange. Yet another 30 million will still remain uninsured. We strongly support these coverage expansions, which open the door to a broader healthcare system for many of our patients. However, we know well that coverage alone does not equate to access.
Our current influenza epidemic highlights the vulnerabilities of our current patchwork for healthcare delivery. Too few people in this country have access to a primary care provider. Their primary care provider could have educated them about influenza and the need for influenza vaccine. Instead, we are witnessing tens of thousands of people presenting to our emergency rooms sick and looking for help.
And where are the doctors? Here's one. Dr. Mark Siegel. He's a member of our Fox News Medical A-Team and an associate professor of medicine at NYU's Langone Medical Center, which I highly recommend.
Thank you.
I had both of my children there. So they are saying what you have been saying on this program for years, which is there is a doctor shortage in this country. It is severe already, and it's going to get more severe unless something's done. It's going to be really severe once Obamacare kicks in earnest and all these millions of people come onto the rolls. Who's going to see them, Doc?
Well, you know, Megan, and the main thing that was focused on there in the lead-up is that it's primary care doctors we're worrying about most. That's me, a vanishing species. Here's what a primary care doctor is. It's an obstetrician gynecologist, it's a pediatrician, it's an internist, it's a family practitioner. It's the front lines. It's the person that says to you, you know, you're having the flu. Don't go to the hospital. Come see me. Stay at home. It's someone that gives you the basic advice. Now, hospitals love specialists. Why? Because specialists make money for the hospital.
Why is that?
A surgeon will bring someone into the operating room. Then in the operating room, they'll be cleared by a cardiologist, then an anesthesiologist. The services of the hospital are utilized by specialists for the main part. Now, of course, hospitals rely on primary care doctors in order to bring patients in, but they can turn around and put them all on salary and pay them less.
Well, this is part of the problem. The primary care docs don't get paid nearly as well as the specialists. In particular, there's some specialties in medicine that still get paid very well. I mean, anesthesiology, ophthalmology, radiology, those are some, dermatology in some fields, but not the primary care physician. Why is that?
Well, I don't want our viewers to shed tears for me, but we get 30 to 60% less than the specialists do. And that's a worsening problem when you consider that we're asked to see more and more patients and our expenses keep going up. Now, one thing that's happening to try to stem the tide of that is more and more nurse practitioners are coming in. We're seeing 80% increases in nurse practitioners, but they're not paid that well either. We end up with a medical team. In other words, you go in, you think you're seeing one doctor, you see no doctor at all. Some hospitals actually have physician's assistants or nurse practitioners, even seeing patients in the intensive care unit. So, Megan, you end up with a situation where you see a team. But you may have relied on one good old doctor all these years, and now suddenly there's 5 people, there's a care specialist
there's a
analyst.
benefit to having that one doctor know you and know your history.
Somebody could be really pissed off at you. Somebody could say, hey, they spent too much of the hospital's money. You could end up with this team, some of which you like, and some of which you don't like. You may not get the care you used to get.
Here's the thing. They're saying that all these people are going to come on to the insurance rolls and be looking for doctors. Not just that, but we had a report yesterday about how in Chicago now they're considering pushing people who they can't live up to their promises to take care of their health benefits once they leave their employ, the government's employ. They're saying, let's let Obamacare take care of them, push them onto the exchanges. Then we have a report that now they're, you know, as our viewers know, they're trying to potentially legalize up to 11 million illegal immigrants who are in this country within the next, let's say, decade. Then if they're U.S. citizens, then they have the right to take advantage of Obamacare. Who's going to take care of all these people? And if they can't be taken care of, will President Obama's promise of if you like your doctor, you can keep him be true for those of us who now have insurance and have a doctor-patient relationship?
With all due respect to President Obama, I have always thought that that quote is one of the most absurd quotes, especially when you look at Massachusetts, which has seen an 82% increased rate for primary care doctors since that bill passed up there. And that's the precedent for Obamacare. 82% increase rate. You know what's going to happen? People go to the emergency rooms. And the emergency rooms, there's 10% less of them. They're already overcrowded. So you're going to have to wait. You're not going to see your doctor. You're going to have to wait.
Dr. Siegel, thank you.